Good evening, everyone. I am Dr. Joshua Thornsberry, and I am an adult nurse practitioner, a VUSN alum, previous VUSN Alum Association president, and tonight's moderator. Thank you, all of our attendees, for joining us. Tonight, we will discuss how to navigate salary, benefit, and contractual negotiation after receiving a job offer. And later, we will transition our conversation to discuss how you prepare for and request a salary adjustment. Tonight's questions are a blend of student submitted questions and conversation prompts that focus on tonight's topic. So please feel free to use the Q&A box throughout tonight's presentation. Our panelists will do our very best to answer these questions throughout the presentation and at the end of the presentation if time allows. So I'm excited to say I'm joined tonight by an esteemed panel of nurse practitioners, educators, and leaders. So at this time, I'd like each of our panelists to share a brief introduction and tell our audience what unique qualifications that they have that make them suitable for our conversation tonight. I'd like to start with Dr. Leslie Hopkins. Leslie?
Hey, Josh, thanks. It's good to be here. What are my unique qualifications? Well, let's see. I did everything wrong when I negotiated my first job, like everything. Josh was one of my former students, and so he's heard some of my tales. So, over the 20 some odd years I've been on the faculty, I think I've learned a thing or two about how I could have done that better. And so, part of what I like to do is teach students by example, and sometimes that means teaching you what not to do. So I'm the director of the Adult Gero Primary Care Program at the School of Nursing, and these are always fun. Thanks for having me.
Well, thank you, Leslie, for being a part of this conversation tonight. Holly, I'll turn to you.
All right. Hi, everyone. I was probably most recently in y'all's shoes in the School of Nursing. I graduated in 2018, and I am a pediatric primary care provider in the Baltimore area. So I think while I don't have the same wisdom or experience as the rest of these panelists, I do come at it from a different perspective of just being very new to practicing and contract negotiating and what the heck does all of that mean. So hopefully I can impart some of my, like Leslie said, mistakes and wisdom on y'all from what I've learned. So nice to see everyone.
Great, great. Thank you, Holly, for being here tonight. Next, we have Dr. Susan Yaxon. I hope I pronounced that right. Susan?
You did great. So I am a Vanderbilt Bachelor of Science in Nursing grad, so that shows you maybe how much time has passed. And then got my master's degree from St. Louis University. I'm actually CNS trained, and then a PhD for the University of Kentucky. I'm APRN licensed in the state of Kentucky, and I've been in 2 states. It seems like when I think back, I might be best at I'm a good nurse. I'm a great nurse, but I'm really good at writing proposals too. So right out of graduate school, I wrote a proposal for the first job I was hired into, and then wrote a proposal for a job sharing arrangement after that, and did that for multiple years. I've mentored and advised many APRNs. I'm currently the associate editor for the AP department for the Clinical Journal of Oncology Nursing. So we focus and publish articles of interest to advanced practice providers. And I'm currently in an associate vice president nurse scientist role with the Baptist Health System. So we have 9 cancer programs, and I'm over the oncology service line as the AVP. And my main goal right now is actually working on recruiting and retaining advanced practice nurses. So mostly outpatient, but some inpatient stuff as well. So that's me.
Awesome. Well, thank you, Susan, for being here tonight. So it sounds like we've got a great panel. So I would like to go ahead and jump right in. So, all right, you've got a job offer. And now that the offer is made, should you take it? So Leslie, I want to direct this question to you. Should I take it? And how long is really a reasonable time to respond back to your employer to say, hey, yeah, I do want that job?
Yeah, so I think my initial reaction to the question is, well, I don't know, it depends. Is it a job you really want? If they made you an offer that's good. I know I'm just going to speak to some of the pre-specialty students out there. I know that I had a lot of imposter syndrome and was worried that I wasn't going to get offered a job. So when I did get offered a job, I probably did not do my, not probably, I did not do my due diligence. And I said yes too quickly. So I think it's reasonable for you to say, I need some time to talk to my family, to think about this. When do you need an answer? Or I can get back to you by ... whatever, whatever day it is. Depending on the size of the organization that you're interviewing with, you may be told this is the first round of interviews, and there's a second and a third. And so sometimes that offer doesn't come immediately. It goes through several stages before you get it. So a lot of times, whoever is interviewing you will give you some indication as to how long the process is going to take. I have heard students tell me that they have been offered jobs on the spot, not usually by larger entities like a Vanderbilt or a Baptist system, but by smaller, individually owned practices. And I think if you're offered a job on the spot like that and they're pressuring you for an answer, you should listen to your gut, is what I would tell you. And that's not a very common practice, is to offer somebody a job, right on the spot. So I took a job because it was offered to me right on the spot. My gut was telling me no, and I did it anyway. And I learned some valuable lessons. But if your gut is telling you maybe not, then I would listen to your gut, I think is what I would say.
Yeah, that's some great advice, and I'm sure we will get into what your gut told you a little bit later. All right, I want to turn to Susan. So, Susan, what are some things that the nurse practitioner can do beforehand, basically some goal setting, to help understand what it is that I want before I take that job?
Yeah, I think this is a lot of discerning. So thinking about what your goals are, and I usually, tell people to think about what your track is, and this job should keep you on that track, and that takes a little bit of thought, right? So this is a big deal. You want to think about what are things that are most important to you. So when you make any big purchase, you think about what you're willing to negotiate on, right? So this is important, so maybe salary is really important to you right now. Perhaps work-life balance is more important to you right now. Some people, retirement benefits, are incredibly important. And so you need to ask that question up front. And if that's a really important thing for you, it may steer you, to one place over another. Or perhaps tuition benefits are important to you for the future, for dependents of your own. And if that's the case, you want to work somewhere, where you're going to build up tenure, perhaps, and have that, be in your bucket, right? That you've got it. So thinking ahead to what are the points in a negotiation that you can give on, and what are the things that are absolutely essential to you, so there are jobs that I've taken and jobs that I've passed up, because I knew what was going to put me on track and what was going to take me off track. And I think that's really, really important in the negotiation part of it. So just think, 2 years in the future, 5 years in the future, maybe 10 years in the future, but what's going to keep you on the track that you want to go on, and what are you willing to give for?
Yeah, that's some great advice. It's not just about the number, right? Not about
Right.
just about the salary. There's a whole package there that we need to talk about. All right, Holly, I want to bring you to the conversation. So, what should be included in the contract besides salary?
Yes. So Susan touched on a lot of important things. Obviously, I'm still in my first position as a nurse practitioner and practicing nurse practitioner. So, a lot of this stuff becomes something that you think about after the fact. But like Susan said, it's all about your priorities, and that's not going to be the same for all of you. So, looking at, long-term versus short-term goals that you might have for yourself, looking at compensation plans long term, talking about signing bonuses, talking about, what does upward mobility and raises look like in the future? Are there certain, as a new nurse practitioner, it can be a little jarring to even see, licensing, credentialing, all of those fees, they all add up. And as somebody coming out of school with, Lord knows, hopefully less debt than I had, but as somebody, that's something you have to think about. And for a lot of us, it's not something that, we thought too hard about initially. So, all of that kind of stuff, continuing education, like she said, is, that part of some sort of package moving forward. And then, things like benefits, so health insurance, retirement plans, and like she said, work-life balance. So are you going to be required to work overtime? Are you going to be required to take calls after hours and things like that? What are the schedule expectations? And these are not things, that y'all have to have a conversation with, the employer about. These are things that you want to know going into these negotiations to say, these are the things that are important to me. And is it possible to get there? Obviously, there's all sorts of other things, non-compete clauses, whether or not you can practice in the area, maybe for, someone newer to the area, or, if you're moving somewhere for a job, that might not be important to you, but for somebody who wants to be somewhere long-term, that means, do I get to practice in a certain mile radius, or, whatever they determine that as. And there are a few other things, obviously that would vary based on, everyone's role, but I think those are some really important, big picture items that y'all want to make sure that you narrow down and focus in on, before going into these, because, having a clear picture for yourself will just, end up making negotiations a bit smoother.
Excellent information, Holly. Thank you. Susan, let's turn back to you. Let's talk about the notice clause. So explain what that is, and what do I need to say so my new employer doesn't really think I'm already thinking about leaving the job that I've just took? And what's a reasonable amount of notice to give?
Well, first of all, the reasonable amount of notice to give is the amount that they tell you, right? So that's like the bottom line, for any professional. You always want to play by, the expectation, right? And that's what you've agreed to do. But we're professionals, and this is an advanced practice role, and they're very hard to replace, right? So, a minimum amount is what they tell you, but hopefully you're leaving for a good reason, that's yours to make, and you loved where you work, and you want everybody to be successful. And with that in mind, as much notice as you can give people is much better, so, 2 months is better than 1 month. We know how long it takes to replace a nurse practitioner. I just read something today that, it takes about $115,000 to replace, a functioning nurse practitioner, so it's a big deal for the employer that you're leaving. So, I would generally say more than a month, anytime you can. Everybody understands when you can't, but certainly what is the minimum that you agreed to, more is absolutely better for the practice. And we all know it's better for your patients. So we care about our patients, and we care about the health of the practice as well. And working together with everybody is really important.
Yeah, that's a huge point there. It's a mutual respect that you have, not only for your employer, but for your fellow colleagues as well as your patients. So it's all about continuity of care, and we're in this because we want to care for patients. And so being respectful of those notice clauses is important. This may segue into the next question, but what would happen if an employer, so you've signed a contract, and what would happen if you made an employer made a change to that notice clause? Would you need to seek some type of legal guidance on signing some type of like letter of acknowledgement for that? would you need some attorney to take a peek at that, or is that something that you just go ahead and sign and move on?
So that's a hard question. It's another one of those that I would say it sort of depends. It depends on what the notice is about. Usually, in my experience, when there's some kind of a change in employment terms, the notice is actually part of the communication, and usually it's HR that's told someone that this has to be done, right? And so it's a way of making sure that it's communicated, the message is given and the message is received. So it really, I mean, it kind of depends on what it is. I mean, if it really changes the terms of your contract, then yeah, I think perhaps it should be fully investigated. If it's something relatively simple, then maybe not, so it really does kind of depend. But if it massively changes the contract, perhaps.
So Holly, kind of on the same topic, do I need a lawyer to look at a contract before signing it? Did you have a lawyer look at your contract?
I did not. I had my parents and my husband look at my contract. So y'all take that with a grain of salt. But I think, at the very minimum, just getting another set of eyes on it, because, especially when it comes to legal jargon, I don't know how many of y'all might be lawyers, but a lot of that stuff is hard to look at when you're looking at a contract, especially, as a scientist. That's not my language. That's not the language that I speak. That being said, I actually do have a couple of friends who are employment lawyers, and they basically were like, later on in the career, that might be something, worthwhile, just because there is a lot more involved when you're a more experienced provider. But initially, I don't think that it's necessary. Like I said, if you have resources and you have lawyers that by all means, ask them to do you a favor and check it out. But in my opinion, I didn't think that it was necessary. As long as the things that I valued were in there. A lot of the minutia just kind of, wasn't on my radar. I don't know if either Leslie or Susan, if y'all have any.
So I will just say that I also did not have anybody look over my first contract, except my dad, and that didn't serve me well either. So what I would say is you need to understand every single thing that's in your contract. So if it's written in legal jargon instead of medical jargon, because we all have our own, languages, if you don't understand the legal jargon, either they have to explain it to you until you do, or you need to go to somebody who speaks legal jargon, who can put it into easy to understand terms. So, do I think you have to have a lawyer? No, but you better understand every single thing that you are signing, is what I would say.
Yeah, that's some good, strong advice. That goes with any contract that you sign, whether for a job or for a car or a mortgage or whatever.
Right.
Understand what you're signing, right?
Right.
All right. There's a question in the Q&A box. I'll just bring it here. How do we make sure? So Callie asked, how do we make sure that the organization provides tail coverage for liability insurance?
So I'm not an insurance expert. I will say that what I understand tail insurance to be is insurance that would cover you after you leave a position, right? For liability afterwards. The answer to that is you have to ask if they've got it, and if they do have it, what does that look like? I think the bigger, more important question is, do I need to have my own malpractice insurance? And what I would say is yes, you do. And the Nursing Service Organization, NSO, has some really reasonable priced malpractice insurance for NPs. We don't get sued a lot, thankfully, so it doesn't cost a lot to insure us. And we'd all like to think that our employers have our best interest at heart. But ultimately they have the business best interest at heart, and that covers the institution, and you want insurance that will be specific for you and only you, if you need it. And hopefully you never will. But when you do, you want to have it. So
And it's usually not that expensive.
Right.
not at all. It's not as, I don't think it's as expensive as, say, your DEA license, which is a lot of money.
All right. Well, Leslie, while I have your attention, what are some things that you should avoid when negotiating a contract?
Well, okay, so here are the mistakes that I made. I started kind of sort of negotiating things before we were really at that point. So when I was interviewing and the physician I was interviewing said, well, do you have any questions? My first question was, well, tell me what the salary range is. Well, that's not the right way to go about it. So I think you really have to take your cues from who you're interviewing with and how much information has been given to you already. You know, some places, like I said, are really forthcoming and just lay it all out on the table for you and say, here's what we offer and how much and when and where and all of that. Sometimes you have to kind of pull it out of people. That's a red flag for me. If I have to really pull information from somebody about what they're going to give me as far as benefits, that would cause me some concern. So I don't know, what do you avoid? I mean, I think the biggest thing to avoid when you're negotiating a contract is not negotiating, right? Is just taking what they give you and saying yes and running with it, instead of really taking a beat, thinking about what they've offered you, thinking about how that aligns with what your career trajectory, what you want it to be, and then is this going to get you where you need to be? Understanding that work-life balance is important, and tuition, reimbursement might be really important for some people. So you really got to know thyself, as I say to students, and know what's valuable to you and what you want going into it.
So we have a question from the audience that, and this goes hand in hand with things that maybe we should avoid or maybe not avoid. Can we ask that a non-compete clause be removed from a contract?
Sure, you can ask. Yeah.
You can ask for whatever you want.
Yeah. I mean, go ahead.
Sorry, Susan, go ahead.
I was just going to say, the advanced practice contracts in my organization have two options. So there's an option with a non-compete clause. And if you sign that one, there's a bonus attached to that. And there is a contract without. Yeah. So, but yeah, you can certainly ask.
I think too, Josh, a non-compete clause may or may not be something that can hold you to, depending on the state where you work. And if it's a right to work state like Tennessee, they've pretty much taken non-compete clauses out, I think, in Tennessee for that reason, because we're right to work state. They can't hold you to that.
Yeah.
Important to know that.
Circles back to our conversation about lawyers. Maybe it is helpful to have somebody who knows the law a bit better than we do.
Yeah. All right. Well, as we kind of end out this section, I just want to ask, do any of you have any stories about contracts gone wrong or any contracts that have went really well?
Okay, well, I'll just say I didn't do my due diligence when I got my first job. What I was told was this was a very rural area of Tennessee, and we were considered underserved in this area. And so you could get loan repayment. And like every good Vanderbilt student, I was like, I'm super in debt. I need that loan repaid. So I took this job. I moved to the other side of the state. And then I started doing the paperwork, right, for the loan reimbursement. It turns out there were 2 providers, too many per population in that county for it to qualify for loan repayment. And so I had moved my whole life out there. Not just because that was a big part of it. And that went wrong for me. So inside 3 months of my first job, I was like, okay, well, I didn't move out to the cornfield just because I like corn. I'm gonna have to start looking for another job. So if they tell you something's going to qualify for loan repayment, have that in writing beforehand and not take them at their word. And the physician that I worked with, was not malicious or anything. And that he just didn't know. He didn't know what he didn't know. And I sure didn't know what he or I didn't know. So.
One thing I would say, especially right now, is think about asking for some things up front, like a sign-on bonus. So lots of places are giving sign-on bonuses for APRNs, as well as nurses. And then I know you're going to have another session next on CVs, right? But make sure your CV is representative of the job you're applying for. So a lot of organizations, I don't want to say there's a formula, but it's kind of like that. So there's a grade assigned for relevant experience, so just make sure your CV is appropriate for what you're applying for, because that's like the calculation, on the paper. There's the other things like the sign-on bonus and the other opportunities for you to ask for something else, but make sure your CV is relevant for that job you're applying for.
Great stories. All right, so let's talk about the meat and potatoes. Let's talk about salary. And I want to start with Holly. How can I find out what salaries are comparable in my area and for my specialty? Because that's important too.
So first things first, y'all talk to your faculty because they are a wealth of knowledge. Like Leslie, that's a plug for all your kiddos. But seriously, you have to ask. Salary negotiations and talking about all of that stuff is not a comfortable thing for most people. But if you don't ask the question, then you may not get the information you need. That being said, there is plenty of information online, and make sure that you are looking at the specific market that y'all are directing your attention to, because a nurse practitioner practicing in California is going to make a very different salary to one practicing in Tennessee or Kentucky or even Maryland. So that being said, I know, obviously cost of living, tallies into all of this, but I did find some good information. The Bureau of Labor Statistics has a lot of, as far as concentration of providers in certain areas, and you can really narrow it down to where you are looking at. And then, don't overlook some of the simple job posting sites, because they do kind of try to aggregate some of this information as well. And then, any faculty, advisors, mentors that you have, just being frank with them about, where they're at, and it doesn't have to be, I make XYZ, I have these benefits, but, what range are we in? What is the, ballpark I should be in? Because you don't want to undersell yourself, especially, in your first position coming out of school. But you also don't want to be the person, asking for $1 million when that's not the value of the position. So those were a few things, little tidbits.
So if I can tack on to what Holly said, I'll give you a real world example. I have a student who recently graduated who emailed me and said, hey, can you help me? I have these 2 different job offers, and this one is at this salary, but gosh, the work-life balance is not really what I want. I've got this other one that's kind of more like my dream job, and the work-life balance is great, but they're like $30,000 less than this other one. And so we chatted by email a little bit, and she found out, what was realistic for the area she lived in. And I told her, I said, the answer to every question you don't ask is no. And if they really want you, and it sounds to me like they really want you, ask for more than you want, because you can always go down, right? But once you agree to something, you're likely not to negotiate it up further. And she said, oh, that feels really uncomfortable. And I said, well, to Holly's point, I think talking money is uncomfortable for a lot of us, especially as nurses. You know, we just want to help people, and it's not about the money, but it's about the money. Healthcare is a business, and you got to eat, you got to pay your loans, you got to live. So, long story short, she got 25,000 more than they offered her because
Wow.
she went back and said, I have this other offer. You really align with what I want to do. And oh, by the way, I've graduated from one of the top 10 schools in the country.
Right.
Did you know? So you got to try. You will be your own best advocate.
Absolutely. Know your value, right?
That's right.
On the topic of benchmarking, just a couple of other ideas. So there are in specialty organizations, you know, you can sometimes find publications of survey of salary benchmarking. And then I noticed somebody posted about MGMA, but I was going to say that. So there is a benchmarking for salary and productivity. And I don't know that you can do this, but I see the post, MGMA will sell students data for $35 per data point. But hospitals do indeed use that. We use that for productivity, MGMA benchmarking.
And then two, to tag on to, there are some other organizations that offer salary information. I think the American Association of Nurse Practitioners, they collect data on that and they report a publication out every so often. And there's also an application called Doximity, which is more of like a social media app, and they collect salary information and will post from time to time about, you know, most common salaries across the nation. So those are some other great resources to try to find those numbers. And like Holly said, don't be afraid to ask. I think we've always been taught not to talk about numbers, but it's important conversation. So
Josh,
Susan,
can I just
sure.
add one other thing that made me think stuff? I had this hallway conversation with a colleague today who was talking about LinkedIn and how she, for her students, is doing this really robust presentation about how to make the most of your LinkedIn profile. And one of her graduates actually was recruited to his dream job at a much higher salary because his LinkedIn profile was so robust. So don't forget that people may come looking for you and not just you looking for a job. And I'm a LinkedIn novice, but sounds like if I were hitting the job market, that would be something I'd be looking into for sure.
Great. Well, Susan, I want to ask you, so if the pay that my future employer is offering me, it seems too low, how can I ask for more? And what happens if the employer pushes back?
So this is a little bit about, you know, proposing and understanding that healthcare is a business, but also that you are a valued person for that place you want to work, right? So absolutely ask for what you want. As with anything, as the nursing process never fails us, right? Assessment is a great place to start. So know that you stand on great ground for what you're asking, right? So if you've done your research and you know what the salary ranges are and you know about things in that area, then that is a great place to start, you know, and then think about the creative things that we've also already kind of discussed, you know, so like a sign-on bonus, retention bonuses perhaps, or incentive. So if you stay over time, you know, is there an incentive bonus? Is there extra CME money, you know, that you can make sure is thrown in there, you know, so be creative with what you're asking. But going back to that point, you know, make sure that you're being paid your value, know what that market is, know about that specialty position, and ask for it, you know. So if they push back, then, you know, this is no different than anything we do every day, right? So if you get pushback, you're prepared, you know, so you're going to say, here's why I'm asking that, you know, this is the data behind that, you know, this is the research that I've done. I know this, and this, I'm worth this position, you know, I'm going to do a great job for you.
Great information. Leslie, how many times is reasonable to go back and forth when we're trying to negotiate a salary with an employer?
Sorry, I was actually typing in the chat too to somebody. So I think it's hinges on like reasonable. Everybody has a different definition of what is reasonable. I think until you feel good with where you're landing and they feel good with where they're landing, there's always room to negotiate up until the last, minute when you actually sign on the line. So, I mean, what is reasonable? It's reasonable to negotiate until you're at a point where you all have both come to an agreement that you can both live with.
It's great advice. All right. Let's transition a little bit here. So let's discuss asking for a raise. So you've got the job, and you
I am so sorry, y'all.
that's quite okay. So you've got the job. You may have been working there for a while. So let's discuss asking for a raise at your current job. So Susan, when is the right time to ask for a raise?
I think the right time to ask for a raise is when you feel undervalued. So maybe you should be off orientation or, out of residency phase, and you're a productive member of the team, right? But if you're feeling undervalued, you're great nurses and you need to be able to say what you need to say. Now, again, that same thing that I said before, you need to have done your homework, right? So you need to know why you think you need a raise, so are you undervalued in that market? Did you find out that you're undervalued in that practice? That kind of thing. The other thing, and I was really hoping this will come up, so I'll just use this time now. Productivity metrics are incredibly important, and nurse practitioners are hidden in them a lot of the time. So if you are not billing and you're not getting credit for RVUs, and the physicians in the practice are getting all your RVU credit, and your bonus structure is set up like that, you've got to do something about that. You have got to open that conversation and talk about that. So you cannot work as an extender and get full credit for your productivity. So asking for a raise kind of depends on the situation you're in, but if you're a productive member of that practice or healthcare team and you're undervalued, you should be able to bring that up. Most organizations will have a cycle of raises, but you should have an open relationship with the practice manager, or your supervisor, and be able to talk about that. So you're doing a good job for them. We need to bring this to the table.
And Susan, one of the questions in the chat box says, is it appropriate to ask for RVU trends from other NPs and PAs in your clinic to see what they're doing?
Yeah, so as a matter of fact, I just asked this question today, so I'd be ready for tonight. So when we hire a nurse practitioner, we give them that benchmark. So we tell them what the nurse practitioners in that practice are doing RVU wise, because we have a bonus structure set up for RVUs. And honestly, I have counseled so many people who have taken a job, so this is like a horror story, it's not mine, but I've seen it multiple times where a nurse practitioner will take a job in a practice being told that bonuses will be available, and being told, we do quarterly bonuses based on RVUs. So they're told that, but they can never get it because of the way the practice is working them. That's not okay. You've got to understand that, so us giving a new applicant or, a new hire the information about what the rest of the NPs in the practice are making for their bonuses is really important. You need to be able to know that, so you can be successful and get that bonus.
And there's another great question that kind of hits on this too. Could the raise issue be included in the contract? Should performance evaluation be talked about and included in the contract?
Absolutely. I think
Yeah.
that, just, looking at cost of living raises throughout the year. I mean, is there an annual thing happening at whatever specific practice or organization you're looking to join. Is it something where quarterly this gets evaluated for bonus structure and things like that? I think absolutely starting off there, when you're negotiating with the contract, I think that is fully reasonable for any new provider at a practice to ask, at least, if not include in contract.
Great. Holly, what do I need to prepare for when asking for a raise?
Yes. So here we are, knowing your value to an organization is beyond essential. So for instance, just a little bit, I actually am at a practice where it is solely myself and the physician who owns the practice. It is just the two of us. And the more time that passes, the more I realize how valuable I am to him. And that's not tooting my own horn. That's me. I work my butt off and I deserve what I'm getting and I deserve where I want to go. And being upfront and honest about that is more beneficial, that that up front. Because you are, like Susan mentioned earlier, it is expensive to replace us, y'all. It is expensive. And for the most part, most of these providers, they are not looking to replace us. So a lot of the things that we think might be nitpicky or, not worth the conversation, it's worth an ask, because if that'll keep you happy and it keeps the organization from having to replace you, that is invaluable. So definitely, knowing your role and how you are benefiting the organization as a whole is by and large one of the biggest things. But then looking for what else, if there's something else at your practice that you can take on, or, something else that you can improve upon, or something that you've noticed that isn't working. And that, maybe touches on one of the questions that I saw in the chat box of how are new nurse practitioners with no experience, how are they bringing value to the table? Well, that's how, they are a new set of eyes joining an organization. They haven't been, in the system for quite some time. And for my provider that I work with, that was a huge benefit for him, because he then, knew I'm a new set of eyes. I come with a lot of new information and a lot of current research and all of those things. And so just kind of, knowing what you can take on yourself, I think is huge in that conversation when you're going in to ask for a raise. I don't know if Susan and Leslie can kind of touch on that a little bit more.
One other thing I guess I would say about, the productivity thing. So RVUs are one thing, but, being a nurse practitioner in a practice, you contribute to the productivity of that practice in so many other ways, so quality metrics, in my world in oncology, clinical trial time is huge, patient satisfaction, staff satisfaction, it's immense. But we don't do a good job of tracking that, so there are some good articles about knowing your value, which is the quantifiable and then these other parts of these metrics, but we're not tracking them. We have to do that ourselves so that we can talk about it, so what other things do you do to contribute to the success of the practice? And that can help you when you're trying to make the case for a raise or renegotiate a contract, or something like that. So think about the other ways that this practice, runs super smooth and the patients are taken care of. They're staying out of the ED, you're decreasing length of stay, all that kind of stuff contributes to the success of the practice. And it's not really measured well for a lot of nurse practitioners.
Leslie, I want to bring you back into the conversation. What type of information will convince an employer that you're worthy of a raise?
Well, I think we've talked about some of that. Certainly metrics are part of it, not just about the revenue you bring in, but are patients being treated to the standard of care? We're all going to be moving, instead of fee for service, we're going to be reimbursed based on outcomes. And nurse practitioners have really good outcomes. You have your diabetics, right, at goal. You have your hypertensive patients at goal. So you want to know how what's your productivity level, how many patients are you seeing, what kind of money are you bringing into the practice, but you also need to look beyond that to how well are you caring for the patients, and how often are you meeting those really high quality standards, and then the other things like Susan mentioned that you bring to the practice. You're a nursing leader, so maybe you're doing education for some of the nursing support staff. Maybe you have figured out a really creative way to group bill for some diabetic education for a bunch of patients. Like, there are a lot of things that nurse practitioners bring to a practice beyond just revenue. And I think if you can figure out ways to monetize, especially patient education, and again, there are codes for in primary care. I can't speak to inpatient, y'all, sorry, but in primary outpatient settings, you can get reimbursed for a group class on smoking cessation or diabetes education. And I don't know about y'all, but I don't see a lot of physicians in private practice who do that, right? It's all about one patient after the next. So there are a lot of things. I think you need to think about what your goals are, what you're really passionate about. And if you can tie in something you're really passionate about into a revenue generator in your practice, then it's kind of a win-win, right? For everybody, the practice, you as the provider, and most importantly, the patients.
Yeah. And one piece of advice I could share is that as I am kind of preparing throughout the year to have those performance evaluation conversations with my employer, I really build out my CV throughout the year. If I have done something that has, promoted the practice or, whatever, I add that to my CV and I keep a mental note. That's what I'm going to give my manager, because that's what they want to know. And the second piece would be to know how you're evaluated. Ask what those performance evaluations look like, so that you know kind of what you need to be ticking, what boxes you need to be ticking throughout the year, so that when you get to the end of the year and you have that evaluation, you can say, yes, I did this. Yes, I did this. And this is how, I achieved this metric. So just be mindful that this is not something that you prepare for, 5 minutes before you have your evaluation. This is a yearly thing. Make sure that you're always actively trying to improve yourself, so you can get more money out of your employer. Holly, what are some things that I should avoid when I ask for a raise?
So a couple of things, I'll try to be quick. One, don't be afraid to ask. If, like Josh said, you've gone through, you've noted all of the important things that you've contributed to the practice, all of the educational things that us as nurse practitioners are taking the time to do that maybe our providers aren't. A lot of those things have value. So knowing that up front and just asking up front, and asking, maybe now is not the time that the organization can provide a raise. So opening the conversation to, okay, well, when can we readdress this? Getting a hard date on that, because, it's very easy for some, practices and some organizations just be like, this is not the conversation for now, but when? Because I deserve to know that information, and whether that becomes a conversation that we're allowed to have. And then, when I was doing some research for this question, I was looking into, a lot of times it can be a little bit more helpful to give the provider or to give the organization a range of what you are looking for, as far as where your salary is going, versus saying, I want, $5,000 more dollars, or I want $10,000 more dollars, or something like that. But giving a range, based on, the value that you're bringing, I think is way more important than going in and saying, I think I deserve 5,000. And they're like, well, I would have given you 10. So I think giving them a larger range, I think will make everybody a little bit more comfortable, with that conversation.
great information. There's a question in the chat box that comes from Brooke, and she says, "How does a DMP add value to our role as MPs in terms of monetary benefits reimbursement? How can a DMP use this degree to their benefit when seeking jobs?"
All right, I'll take a stab. Ready? Hi, Brooke. She's one of my recent grads who's in the DMP program here. So I think the really harsh reality is right now the market is not keeping up with what the terminal degree of a DMP has to offer, right? So the answer is, if there's a job out there and I apply for it with an MSN and somebody else applies for it with a DMP, is there going to be a money differential? Are they going to pay the DMP more? Probably not, honestly. However, DMP degree hasn't been around terribly long yet. And I think that will change over time, especially now that we're beginning to see the entry into practice become the DMP. So lots and lots of schools are transitioning their MSN programs to a BSN to DMP. So you're going to start seeing fewer MSN grads who are getting certified and more DMP grads who are getting certified. And I think the hope is that nursing is kind of slow to catch up, that eventually that doctoral degree will people will see the value of that within the marketplace, and will see that reflected in salaries. Anybody else want to add on to that?
All right. Well, as we kind of finish out our conversation about salary, Leslie, is there anything else that we need to keep track of? I know we touched on a lot of those things that we should keep track of throughout the year, but is there anything else that we should keep track of between now and the next time that we ask for a raise?
I think you made some really good points about here are the things I've achieved. Here's what I've done in the community. A happy employee is a good employee. So I think it's also valuable to your employer to hear about the non-monetary things about your job that you really love. You've got a really strong team. Everyone's real supportive of one another. If someone's sick, someone else steps up, whatever that is. People like to have happy employees. And if you can articulate that on a regular basis, I think, gratitude is underspoken and undervalued sometimes in the workplace.
Well, one of the last questions I want to ask you all before we get into maybe some Q&A from our attendees is, so after we've done all of this back and forth, all these negotiations and, all these, navigated all these difficult conversations, really, what should I do after that? Is there, should I send a follow-up email, a thank you note, send flowers, some candy? What should I do, going forward? So I want to hear from all of you.
Yes, is my answer. I'm old school and really think a handwritten note is best, but that can take forever. So I almost would think a quick email and then a handwritten note if you feel really strongly about that. But at minimum, an email to all of the folks you encountered, right? Not just one. So if you have a day of interview or you've got a whole list of folks you're meeting with, then I would send one to every single person you meet with.
Susan, what do you think?
Oh no, absolutely. I absolutely concur. It shows you the interconnectedness. It shows you the professionalism. It's absolutely a good thing to do. Yeah.
And I would add, even if there's no way I want this job, like it's just not that these aren't good people, but this is just not the right job for me. You never know how those folks might show up in your life later on. So it's always best to be grateful and professional, even if you know that.
All right, Holly, yay or nay, should we send some follow-up?
Absolutely. It does not have to be a grand gesture, y'all. You're not getting engaged or anything like that. But, at least a thank you email, a thank you note. These people are taking their time out of their day to even interview you and just have these conversations. So, that at bare minimum, it doesn't have to be an edible arrangement or anything like that. But and quick email, it doesn't have to be a novel, but thank you. Appreciate your time. I really respect what you're doing. And thank you for considering me for this role, period. End of story.
Absolutely. And what would be a good time frame to send these types of notes?
Within that week, I would say.
Yeah. I would say the sooner the better, just because, you put that off and you have other interviews and you mix people up. And I would say jot some notes down after your interviews and, make sure that it's tailored to what you spoke with them about. But I would say as soon as you can, even, same day, next day, whenever you're thinking about it and you have time, I would get it out.
Yeah, that's some good advice. All right. Well, let's dive into maybe a couple questions before we end our session tonight. Man, time has flown by. So let's start.
Can I do that one about, there was one that came in just about part-time, full-time. I'll just say, if you're thinking about working part-time in the future, there was a question that came in. I don't know that it was fully disclosed that benefits or things were prorated, but that is quite common. So if you come in a 0.5 position, so you're half of a full-time equivalent, usually your benefits are prorated 0.5. They may even change the structure of it, so your healthcare benefits, maybe you have to be a 3/4 of an FT, a full-time position, to receive full benefits for healthcare. That should be disclosed to you. There was another question about benefits. When is it right to ask about benefits? When you're seriously considering a position, you should ask for the benefits package for all of it to be explained to you.
All right. One of the questions, I think this was back to contract negotiation, is there a specified minimum of time of employment, like 3 years, 5 years? Is that common in a contract, or is that more of a red flag?
I will say that I see that more commonly if an employer is paying for you to go to school, right? So we'll pay for you to go to school. In return, you have to agree to work for us in your APRN role for 3 years or whatever. I would be really hesitant to sign anything that has a real strict time limit on it without an option of leaving if you needed to. And there's always the option to leave. It's just a matter of how much notice, right?
Right.
Yeah. And along with that, I think, it's, you don't want to, I'm having a brain fart. Susan, we thought it was going to be you after a long day, but here we
You're
are.
making me feel so good right now.
Sorry, guys.
That's
All
quite
right,
okay.
Holly, it happens to us all.
All right. Well, I'll ask one more question from the audience. And I don't know if anybody has experience in this, but there is a rise in resident and fellowship programs for our nurse practitioners, which I think is an absolutely wonderful idea. Are there, for these types of contracts, are salaries negotiable for those types of positions?
No.
Yeah.
There's not too many people want those types of positions. There aren't a lot of them in the country. They don't have to be open to negotiation for the fellowship. Now, maybe after the fellowship, if you stay on to work there, there's probably room to negotiate. But most of those fellowships are going to give you this is it. This is the whole benefit package. There's no negotiation. If you don't want it, move on. We'll get to the next person. That's my experience.
I would agree.
Yeah. But that, that in itself should not deter people from wanting those types of programs, because those are, I'm telling you, your first year of practice it's a lot. It's overwhelming. And having a structured resident or fellowship program like that, yeah, that you can't really put a price on that. So, all right. Well, this has been a great evening. And so, Susan, Holly, Leslie, thank you so much for just really making this conversation worthwhile for our attendees. I hope our attendees that are with us tonight, take away a lot of great things from this. I think they will. The good news is we've recorded this and this is going to be available for you to watch again. So if you missed something, just watch for it on our social media channels. I do want to give a plug. This is, I think, number 2 of 4 events that our Know Your Value Committee is hosting. And so we have 2 more left. The next one is going to be, well, I don't know if it's going to be the next one, but we're going to have one about CV writing, which is also another important skill, and also one on networking, which is a phenomenal piece of the puzzle. So watch your student newsletters and social media for the dates and how to register for these events. Again, thank you each and every one for being here tonight. If you have any questions, please let us know. Link up with us on social media, on LinkedIn. We'd love to hear from you. And I hope everyone has a wonderful night. Thank you for being here.
Thank you, Josh. Thanks,
Thank
everybody.
you.
Thanks, Josh.